Hello, my name is Dr. Ben. I am the host. This is a Thursday live stream for our group of audiologists to help you who may have hearing or tinnitus conditions. In today's episode, we will have our special guest, Dr. Ramsay Poindexter, who is here, an audiologist who is a new addition to our team of providers for tinnitus and hearing. Dr. Poindexter, or as we will say, Dr. Ramsay, has joined us with extensive experience in audiology, covering hearing loss, hearing aids, and tinnitus management, is board certified in tinnitus management. So today we will be live answering questions, some of the commonly asked questions for hearing specifically. And if you're watching us live right now, please type in the chat where you're coming from and your questions, and we'll be sure to answer them. Right now, I will ask you, Dr. Ramsay, to introduce yourself. Tell us a bit about your experience as an audiologist and what excites you about helping people with hearing conditions.
Okay, well, you already gave me quite the intro. So I have been an audiologist for 18 years now. I became an audiologist because I grew up with a deaf grandmother. So having had that, I developed sort of this lifelong passion to provide good quality hearing healthcare. And so that's kind of how I got to this point. Um, I've worked in just about all settings. I started my career at UCSF Hospital, so that was a tertiary hospital in the Bay Area, and I was there for quite some time. I've worked in surgery. Did some intraoperative monitoring. I've worked in education, but the biggest part of my career has been in adult rehabilitation, so doing diagnostics, hearing devices, hearing aids, and tinnitus therapy with patients. So that's where I've spent the most of my time.
Thank you. And what excites you? Where is your passion with helping adults who have hearing conditions over the years? What excites you? What kept you coming back being such a devoted audiologist?
Um, that's a great question. I think it's just, having getting to know the patients and their stories. Um, I have met throughout my career some really amazing people, and to work with them and to be able to help them. Hearing is such an important thing. We need to be able to hear. And if there is something that I can do to help them with that, that's going to give me, that's a positive feeling back. So helping people is awesome. It's a great feeling. And when you're doing that, I've also have made some great patient connections, heard some fascinating stories. Um, I mean, I could go on and on with some of my patients' stories, but they've always kept me coming back for more. And and then to know that I'm helping them, even if it's the little things, even if they come into my office and say, and I fit them with a hearing aid, for example, and they say, I was able to hear my granddaughter for the first time, and she's always, told me, grandma, you can't hear me. And uh, anything like that, it's such a positive feeling.
Yeah,
So I think
definitely.
it just always comes back to helping people. I've always enjoyed that.
Absolutely.
Mhm.
100%.
and
100%.
and the connections with the people. Mhm.
Yeah. What do you find have been the most common situations that people need help hearing if they are noticing or someone else is telling them that there's some potential hearing difficulty or something to get checked out? What are the
Mhm.
common situations that you found over the years?
I think that people, well, so a lot of times it's, well, my husband says I can't hear, or my wife says, or my partner says that I'm not hearing well, but I think I hear fine. Um, a lot of people come in based on family members or friends and whatnot saying that they're not hearing well, or they might be at a party or a group event. Usually, we start noticing the difficulties when we're in noisy environments. So I think I think those main reasons. Either they come into my door because a family member, a friend has mentioned comments, or they're commenting that they're having difficulty. And usually it's when it's in a noisy environment, I would say. Does
Yeah,
that does that
absolutely. Yeah.
answer your
Yeah.
question?
Yeah,
Okay.
thank you. Very common. So, one thing audiologists do better than anyone is recommend different technology solutions, recommend different communication strategies for
Mhm,
communicating when there are
mhm,
difficulties hearing. How do you how do you do that, right? How does an audiologist help someone? Well, it's becoming more and more complicated because there's so many solutions
mhm,
available online,
mhm,
in person, emerging over the counter hearing aids. It's becoming a market that is more and more saturated, more and more options, more and more
mhm.
uh,
It's
information. It
right.
can be confusing. So
Mhm,
w- how do you see this going for us, for our audience here, for anyone who's listening? We see Mad Duck from Utah, Tony from Belgium. Hello, everyone.
ooh,
If anyone
Belgium.
else is watching live, please let us know in the comment. What do we need to know if we have a hearing loss today, 2021, entering
Mhm,
2022?
mhm.
What should we know about the pros and cons versus these different options, in your opinion?
Well, I mean, I think I think we're getting into the point where you're right. It's starting to be really confusing. There's so many options available, and now we're approaching this whole concept of over the hearing devices. So you'll be able to go into your local Walgreens or CVS or even online and be able to purchase a hearing device. And so there's going to be so many different options. And we're already, as an audiologist, we try to narrow it down. We talk to our patients, we connect with them, we try to figure out what is the best technology that we can provide them. And we try to make a connection. Well, now they're going to have all these other kinds of avenues to go down, and I think that for us, the best way that we need to embrace that and to honor our patients and be able to help them select what would be appropriate. So, there are some really great options that are available, and it's you know not necessarily available in an office setting necessarily, and
Yeah.
to help them find what's going to be a good fit for them. So to learn as much as we can about all the different options that are available and how we can better serve our patients.
Thank you so
Because
much. Thank you so much. Now we want to answer questions. That's partly why we're here. For those of us who are here for the live stream right now, you can expect this to keep going for Tuesday and Thursday. Tuesday focusing on tinnitus, answering any questions. Thursday focusing on hearing, also answering any questions that come in live. And first question is from Tony. Tony asks, tinnitus from stress, can it be fixed? How do we define fixing tinnitus is a good question, right? How do we define fixing tinnitus? Well, I would define to fix tinnitus to get to the point where tinnitus is not a problem in one's life. There's many health conditions that can be there, but aren't all in all aren't really affecting the day-to-day experience, the day-to-day quality of life of someone. What comes to mind is occasional pain in the body or the nervous system. What comes to mind are other low level health conditions that, so even though we wish it wasn't there, we can manage and live with it. So, how do we get tinnitus to that point? And tinnitus from stress absolutely can get to that point. Every individual is different. So, this is one of those questions where it's hard to give a highly confident answer for you specifically, Tony, because we haven't met you. We don't know your history and your backstory. But overall, yes, vast majority of stress induced cases of tinnitus get better. What my main message here is to be patient. My main message here is to do what you can. And I don't know how long it's been. Again, some follow up information would be helpful. Uh, there are ways to deal with this. There are ways to manage this to get to the point where your brain has defocused and it's not concentrated on the tinnitus as much during the day. And the sound itself through that process usually gets softer too. Dr. Ramsay, the board certification of tinnitus management, that you have the education of tinnitus for the provider. um, how do you approach, right, stress management for tinnitus? Is that any
Mhm.
different than uh, tinnitus from someone who has progressive hearing loss? How does one, in your opinion, how does one differentiate between these different subtypes?
I mean, can we differentiate? I mean, people with hearing loss are going to have stress and anxiety over their hearing loss because they're going to go into environments and know, like, automatic, like they're going to walk into a dinner party and start to feel uncomfortable because maybe they don't want somebody to notice that they're having a hearing loss, but they're having to hear in background noise. That's an incredibly stressful process for your brain to be able to sit amongst background noise and to have a conversation with a person. You are doing a lot of work. So not only
Mhm.
is your brain really occupied with just trying to listen in background noise, which takes a lot of work, and then you add stress on top of that of just having a hearing loss, being with a group of people that makes you feel anxious, uncomfortable. Are they going to notice? Are they going to say something? So there's stress there. Tinnitus stress, I mean, I guess it might be a little bit different because I think what happens with tinnitus is that we have the tinnitus and our body's in that fight or flight response, right? We're emotionally, our limbic system, which is in control of our emotions, is firing. It's going crazy. It's saying, "Alert, alert! There's something wrong. There's something wrong." That's kind of um, giving off a different kind of stress, maybe.
Mhm.
Um,
Yeah, absolutely.
so
Different kinds of stress, and
it's a
th
different it can
there's
be a different
there's
kind because you can think that something's
Mhm.
wrong. There's
Yeah.
something wrong. So once you've gone through the process and, been medically evaluated, have your hearing tested, rule out all kinds of conditions, and we get down to the bottom of why you're having tinnitus, um, usually some of those stresses we can start to let them go, knowing like, hey, everything's okay. I'm fine. I
Well,
might
it's a
have
good
this ringing in my ear, but I'm okay. So that's an automatic way to reduce some of that stress.
Yeah, well, the question is, what came
Mhm.
first, the stress or the tinnitus?
It's
For
it does it
when
sometimes it does it depends.
Yeah.
Sometimes the stress comes first because stress and tinnitus are directly linked. We know that, right? And so sometimes the stress and anxiety comes first and the tinnitus comes as a product of that stress and anxiety. Would you
Yeah,
agree?
I would agree. It's
Mhm.
important to talk about this. It's helpful,
Mhm.
and for those of us who are here in the room live, let us know your thoughts. Does stress make your tinnitus worse, or no, not really? And again, this is for Tony, who asked the question a little while ago. Um, Stress can come first, leading to stress-induced tinnitus, and
Mhm.
then sudden onset tinnitus is stressful inherently.
Mhm. Exactly.
In both cases, learning how to manage the mind, the psychology, the body, sleep patterns, our mental cognitive reaction or response to certain things can only help us.
Mhm.
Tinnitus is psychological, and in that, not completely psychological. There's a psychological component. So
Mm.
there is some element of control over one's psychological state. That's important to reinforce. What I've seen surprise me is how much meditation helps the tinnitus community. I've been meditating for probably 7 years consistently, and the meditation practice of breathing and creating that separation from the sense of tinnitus, let's say, is helpful. So that's just one example. Great question. Let's go to the comments here. We have Johnny Booker asks, my ears just started ringing a month and a half ago. One ENT said to get a hearing test and put on steroids. Then they went to the emergency room to say there's fluid behind the eardrums. Sorry, Johnny, it sounds like you've gone to some different clinics and don't necessarily have a good answer there. So, Dr. Ramsay, do you want to give some perspective, give some opinion on where to start in this case?
Well, I have a lot of questions back for Johnny. Um, he went to the it sounds like Johnny, you went to the emergency room. They found that you had a middle ear infection. Uh, if that itself had cleared up, the question would be what happened to your tinnitus, right?
Yeah, that is.
Um,
I'll
and
I'll just
so
I'll just I'll just add that
mhm,
this live stream is not the time and place for, unfortunately, Johnny, for us to go back and forth and really take a full case history. So
mhm,
for those asking questions, keep asking them. We'll do our best to answer. And for those who want a more in-depth discussion on this, we have providers who are available. Just reach out to us or find a local provider who can
mhm,
specialize in tinnitus.
mhm.
Dr. Ramsey, so
I would
knowing
say
this.
for Johnny,
Mhm.
go back. You've been to the emergency room. If they did anything to treat you, um, that's good. Then your next step is to go back to the ENT, be seen, get the hearing test, see what would come next.
Yeah, for some cases of sudden hearing loss, steroids, like you had mentioned
Mhm,
here,
mhm,
are prescribed, and that's normal, right? There's nothing wrong
mhm,
with that. If it's sudden tinnitus, usually steroids for sudden tinnitus alone are not prescribed, but occasionally they can be. So it is good to stay close with your ENT physician. And if you, for some reason, are not happy or feel like you want to go somewhere else, then do that. So you'd have to advocate for yourself a little bit and make sure you're getting seen. Just know that if it's been a month and a half and your ears are still ringing, then it's probably a good time to consider professional help
mhm.
wherever that makes sense for you. ENT, audiology, potentially both. Please reach out to the professionals you need to potentially help you. Thanks for asking the question. All right. Mad Duck asks, other than meditation and sound therapy, what more can I do to calm the tinnitus down? So thank you for asking the question. Great job for using those tools, meditation, other forms of self relaxation, control of one's lifestyle can make a big difference, and sound
Mhm,
therapy can make a big difference as well. So although there may be room for improvement with both of those areas, let's try to answer this question.
mhm.
Dr. Ramsey, what comes to mind in terms of
So,
what else other than meditation and sound therapy?
anything that we can do to calm our nervous system is gonna make a positive impact on our tinnitus. So, anything that we can do to feel better, okay? So, for some people, that's, meditation, it might be yoga, exercise, good diet, restful sleep, hobbies, things that make us happy. The All of those things are going to calm our nervous system, which will change the perception of our tinnitus. Because again, we know that tinnitus, stress, anxiety, they're all linked together. So things that we can do to better care for ourselves, it's not only is it going to impact our overall general health, well-being, work, relationships, whatnot, it should and would positively impact tinnitus. So acupuncture, all the things that we can do to feel better
Excellent.
that will make a positive impact. Mhm,
Excellent.
mhm,
And keep doing it. Don't
mhm.
try it for a few days and stop. Tinnitus
Right.
is an ultra marathon.
It's
You need to use the toolkit. You need to use the tools in your toolkit that feel good. You also need to trust professionals who are saying ride certain tools out. Certain tools won't feel good the first time you do them or won't necessarily change your tinnitus loudness or impact. But over time, through the system that affects tinnitus, we know certain things like sound therapy, certain things like self guided relaxation, breathing techniques probably will feel hard at the beginning or uncomfortable and potentially bring more awareness and more attention to your tinnitus at the very beginning. But after a few weeks of trying them, you're likely to feel some benefit from them. So, great question. Thank you so much for asking. All right. How are you guys liking this tag team? Two audiologists, two for the price of one. If you're here with us live, please let us know in the comments the questions you have. We'll do our best to answer them. All right. A few of these questions we're not going to answer. That does not mean we don't care about you. It just means that perhaps that question is best answered in a one-on-one format because we don't know the context of your history. And please pardon us for that if we skip over your question. But thank you for asking. So, all right. Okay. Our wonderful Facebook user asks, I'm new to tinnitus. I had it for 1 month. I'm still having some tests ran. My body went haywire. So, Dr. Ramsay, let's talk about new to tinnitus 1 month in.
Mhm.
What are those tests that we should have completed? What are those initial
Okay.
tests through different professionals that we should try to get completed? I'll add, you start.
So, one of the first things we want to take a look at is your hearing. So good to start with either an ENT or an audiologist, have the hearing tested, make sure that, see how that looks to, the results of that will be able to determine whether or not a medical referral is necessary, to delve deeper into, if perhaps there might be a medical issue going on that could potentially be resolved or at least needs to be monitored. So, starting there, is always good. And then that will, once you start with that with a professional, it'll kind of trickle its way down to a final point, final, start with an audiologist. They might refer to an ENT. If they find something there, they might refer on to, if there's a vascular issue or whatnot. But you want to definitely start in the care of either your physician, audiologist, et cetera, to get the ball rolling. And oftentimes, the very first thing they're going to look at is your hearing. Mhm.
Hmm. And if that hearing test is symmetrical, right and left the same,
Mhm.
eardrums healthy, you might just stay in the audiology ENT realm.
Mhm.
If there are certain other conditions, they may uh, cause the provider, the doctor, the ENT, or the audiologist to recommend other tests. One thing that, and this shows that there's so many different potential factors for tinnitus. It's not a one size fits all solution. It's not a one size fits all test. There is no one tinnitus test that's going to catch every single thing. So you have to be diligent and patient. Now, my main message while we are getting different tests completed, start managing the tinnitus ASAP. Start managing the tinnitus properly from the onset. That means don't wait to get professional help. Don't wait to use sound therapy. Don't wait to put the recommendations and guidelines in your life because a few reasons. Sometimes those medical tests can take weeks or months to get the results back or get the test completed. Secondly, tinnitus for vast majority of cases, there's not a medical test that's going to stop it or make it go away or turn it off. Therefore, we need to, as quickly as we can, start managing tinnitus in a very real way with potentially professional help, but definitely considering sound therapy, the holistic methods, and understanding the cognitive tools of I'm not fighting my tinnitus. I'm not trying to resist this. I'm trying to accept this for what it is. I don't love it, but for now, I'll try to be neutral and not react to it. To me, that's another strong recommendation for those first few months because Dr. Ramsey, I don't know about you, but I've definitely seen cases and met people and seen online testimonies where after a few months, tinnitus went up, but then it came back down either to baseline
Mhm.
or people don't hear it too much. So there are those cases where it can change in the first few months. You've seen those,
Mhm.
right?
We see it all the time, and I think, uh, um, a lot of that is happening because when they come and see us and they have the test, they find out, okay, there's nothing really going on. There's a lot of habituation that can occur right then and there, because a lot of the stress and anxiety is just automatically reduced, because it's okay, there's nothing wrong. There's nothing wrong with me. I don't have a tumor. Nothing's, all these things have been ruled out. And oftentimes that alone is enough to help a person's, we help a person's perception of their tinnitus, or help the way that their body is responding to their tinnitus, and then that automatically just gets reduced.
Yeah,
you know
excellent. Thank you so much for the question. Okay. Okay. Just a quick comment from Taylor. Thanks for commenting, Taylor, that one can have benefits when we dissociate tinnitus from that fight or flight response. That fight or flight response is essentially the result. It's the body reacting to something that it perceives in the brain, and the body reacts in a fight, flight, or freeze type response. Just notice that, just practice when you're feeling that tense, tight fight or flight reactivity to life in general or to tinnitus. Stop, check in. Usually the breath is shallow, usually the stomach is tight, usually the shoulders are tense, and potentially the face and the head is tense. So this is where you can use some holistic, practical ways of calming oneself down and not being reactive to tinnitus. This is hard. I'm not saying this is easy, but this is what you need to try to do. All right.
Mhm.
Let's try to, Dr. Ramsay, if you have any comments on that, please do. I'll pull up the next question.
No, I was just going to say that yeah, part of our brain, part of the habituation, really, it just means that we change our own emotional response to our tinnitus, and that is very possible to do.
Yeah. Thank you. We have a question from Mark on YouTube. Mark asks, I'm doing TRT for low frequency sudden sensory neural hearing loss. I went to the ear, nose, and throat doctor and did 2 weeks of steroids. Recovered hearing, but the low level tinnitus remains. The ENT does not think I have Meniere's. Thanks for sharing good details. That helps us, gives us some talking points. Dr. Ramsay, first off, low frequency hearing loss,
Mhm.
sudden sensory neural hearing loss. Can you give us a little context on what that means?
Um, well, they've ruled out Meniere's. Off, Oftentimes, well, are you asking possible etiology?
What does low frequency hearing loss mean for people
Okay,
who don't know?
so low frequencies are the bass sounds, right? So we hear bass sounds all the way up to treble sounds. So when he's saying he has a low frequency hearing loss, he is having difficulty hearing, or Mark, you are having difficulty hearing the bass sounds. Examples of that in speech would be vowels like a. Those are all bassier sounds. Treble sounds are more like the S sound, the TH sound, birds chirping, things like that. So it's a difficulty in that low frequency range, and that's what
Mhm.
what Mark's been experiencing. Mhm,
Yeah. And then occasionally someone can have a sudden hearing loss,
mhm,
and sometimes that comes back naturally. Other times steroids can help bring that
mhm,
back. Now the hearing got better, but the tinnitus remains. This is something that we don't only see with sudden sensory neural hearing loss, but we also see with ear infections, or even sometimes earwax being removed. That, well, the medical structural hearing loss or the sudden hearing loss, the medical hearing loss, got better, but my loud tinnitus that was there is still there.
mhm,
And does this mean it's there forever? What's going on? The ENT doesn't have anything for me. What should I do? Should I use hearing aids? Should I try something else? Is there something that they're missing? Those are the common questions we get, and we can help with
mhm,
that. So my advice would
mhm,
be, continue with the TRT that you're doing. And
mhm,
just to clarify, TRT includes sound therapy, professional counseling, usually one on one, and proper education on what exactly is happening. All of those
Mhm.
mechanisms can help the brain defocus from the tinnitus and can help facilitate the neuroplasticity that needs to happen to help reduce the perception and or habituate. When that happens, usually the sound gets softer too. So
Mhm.
that's essentially the what we're dealing with here. Um,
I think Ben or Dr. Thompson, another
yeah,
thing that
please.
we can add is mark to check and see if the hearing loss is something that would benefit from hearing aids. So that's something you might want to ask your audiologist. I don't know the degree of hearing loss that you're experiencing, but if it is something that may benefit by the use of hearing aids, that certainly may help your tinnitus as well. Because right now there's certain sounds that your brain is missing, and your brain's going to be happier if we give that back, and hearing aids is a way to do that. So I would definitely follow up and see if that's if you are a candidate or if it would be of benefit.
Yeah, we
Mhm.
always want to follow up on that because sometimes when patients say, I'm doing TRT, we have to clarify, okay,
Yeah.
sometimes that's a term that's thrown around a lot. Does that mean you're playing a smartphone app or does that mean you're consistently following the protocols? There's some variability there. Thank you so much for the question. All right, Dr. Ramsey, I'm going to give you the floor. If you have some things to share to the community here, I'm going to look through and get one or two last questions before we wrap up. Just want to give you the floor before we wrap up.
uh okay, give me a topic. What do you want me to talk about? Throw
All right.
something at me while you're looking at questions. I'm on the spot.
Just everyone just take a break. I'm going to look for some questions then. Uh, okay, good question. This one's for you, Dr. Ramsey. Sound therapy recommendations for high pitched tinnitus.
Mhm.
Where would you start?
Well, you can start with apps, things that you can download to your smartphone, your iPad, that anything that you would find relaxing and soothing. So that could be a white noise, it could be rivers running, waves, rain, any fan noise, anything that is relaxing and comfortable and set at, you don't, nothing that you want to listen to too loud. You kind of want to mix it um, with with where your tinnitus is at is a good volume. But I would just say anything that's comfortable, and you can start with just an app on your phone, and then of course we can go all the way up. They make there's sound generators that you can actually have by your on your desk or bedside. Um, but apps, you can start there and then move your way up. There's all kinds of different ways to deliver sound, all the way to hearing aids have the ability to amplify sounds around us, but also have they're called combo units, but have sound generation inside. So
Yeah, there's two parts.
there's a lot of different ways to get sound therapy. But for high pitched tinnitus, I don't think it really. You can clarify this, but Dr. Ben, is my understanding that really, as long as the sound is comfortable, relaxing, consistent, that I'm not sure there's one specific for high pitch. I know that there's been a lot of comments about cricket noises but I don't know if there's one particular sound that is of benefit. Do you know?
Uh, yeah, there is no one magic sound therapy.
Yeah.
Like just like
Okay.
just like you said, there is no one magic
Mhm.
sound therapy. And I love this question because most people have high pitched tinnitus. So what do most people perceive benefit from with sound therapy? Well, there's a few ways to look at this. The typical recommendations for what kind of sound to listen to are essentially sounds that have a broad frequency response. That means not just musical tones, not just very high pitched tones that match your tinnitus, but sounds that cover a full range of bass, mids, and treble. Things like natural sounds, water sounds, which Dr. Ramsey recommended, things like white noise, pink noise. Actually, the Apple iPhones have something new in the iOS 15 as of about a month or two, which is something called background sounds. And they have 6 preset background sounds, which I've been experimenting with, and you'll see that in some upcoming videos, that the essentially Apple has sound therapy that can come from the iPhone or can stream through hearing aids or Bluetooth devices. That's an example of some common sound therapy that's effective. Crickets is also one that is a little more unique in the sense that probably most professionals don't recommend it, but people with tinnitus who are experimenting tell us, hey, that those crickets really work.
It's more, yeah, exactly. Like, I hear a lot of patients say that the cricket noise is, I've just heard it before. And, but yes, it's nothing that we know. There's no evidence saying that that one particular. And I think it's also super important to point out, this is a really good question. You don't have to you don't have to match your tinnitus. A lot of people come to or ask me that question. Does the sound therapy have to match the tinnitus? And it does not. So for your high pitched tinnitus, Facebook user, you don't have to match your sound to that high pitched sound for your sound therapy to work.
Yes. Excellent question. Let's do one more and then we're going to wrap it up. Just so you guys know, we are doing this live question and answer for you, for our community on YouTube and Facebook for Tuesdays and Thursdays at 7 p.m. Eastern. So I hope you can join. I hope you can pencil it in your schedule to come back. We love it. We know this is helpful. And it's a sense of community as well. Everyone who's responding in the comments, you get to learn from each other's history, hopefully help each other, right? We are trying to be helpful after all. So let's be kind to each other. Okay, I'm going to pull up the last question. Give me 1 second here. All right, this is one of my favorite questions. Marion
Oh, so you're
asks,
already going to know the answer.
maybe. Marion asks, all right. So
Oh,
Marion
tinnitus and
from
traveling on a plane. That's a
so
really
Mary
good question.
Marion from Facebook asks, tinnitus and traveling on a plane, what are the considerations here? I want to start, Dr. Ramsay. So,
Yeah.
tinnitus, traveling on a plane, there's two major stresses, concerns, fears about traveling on a plane. There's really two major aspects to cover. One is the plane too loud? Because my tinnitus, I cannot afford it to spike. There's no way I'm going on a plane if it's going to spike my tinnitus. I'm trying to keep my gains or at least hold my ground. I cannot afford to have a spike in tinnitus. The second thing is, what about the cabin pressure? Are my ears safe? Is there any structural reason that my ears will be damaged because of the changes in pressure? And will that make my tinnitus worse? Well, in both cases, the answer is you're safe. And I'll explain that right now. So, for the sound therapy, the sound levels of a plane are typically under 80 decibels. And we know through science from the government, they need to keep the employees safe and making sure they're not around too loud of sounds during their work week. So you'll notice the flight attendants are not wearing earplugs, but they're working 40 hours a week on the planes, right? Well, those loudness levels are safe, meaning that they will not cause structural damage to the cells in the cochlea, the little hair cells that are the organ of hearing. So, from a structural place, the loudness of the plane is fine. You're encouraged to use earplugs or noise cancellating headphones to make it more comfortable. Okay, the second part of that question is, what about changes to pressure? Will changes to pressure cause my tinnitus to get worse? The answer is no, unless you have some of these potential symptoms. If you have ear pain, if you're noticing a sudden change in hearing, if you're having congestion, if you're feeling stuffy, if you cannot equalize the air behind your ear by blowing out of your nose, then you may have what's called eustachian tube dysfunction. And that's usually temporary. It's usually medically managed and can be cured. But temporarily, that means you won't be able to equalize, and having changes in pressure on a plane could lead to something damaging like popping your eardrum. So for most people, that's not what's going on when they have tinnitus and they're going on a plane. Therefore, they're completely fine. Changes to pressure don't spike tinnitus for longer than 2 seconds, and you're totally safe to fly. Extra important because now we're entering holiday seasons where people fly all over. So, as you can tell, I've been studying this question. From what I've seen, those are the two major anxieties or stressors that people have about flying. And thanks for asking that question.
It's a really
Dr.
good question.
Yeah, it's a really good question. Thanks for letting me take that one, Dr. Ramsey.
No, it's
As we're
totally fine. I was like, oh, that was really good. Good
Thank you,
answer.
thank you. I've been practicing. I just wanted to share it with everyone.
Yeah,
As
that's a
we're
great question.
It's a great question. As we're wrapping up, do you have any last words of hope or encouragement for those who have tinnitus or hearing loss?
Well, I'll start with the well, hope for everything. We can't cure the tinnitus, we can't cure the hearing loss, but we have so many tools to make things better and to positively impact the tinnitus, to positively impact the hearing loss. So, never feel like you're cornered, never feel like it's hopeless, helpless. Of course it's not. We're here to help you, and we have so many. Again, I've had a long career. It's hard for me to say out loud how many years, but in the 18 years from when I started treating patients to now, I've seen huge advances in technology. So my toolkit is growing and it continues to grow. So that just provides me with more options to treat my patients. So there's no reason to feel discouraged with hearing loss. There's no reason to feel discouraged with tinnitus. There's so much that we can do to make a positive impact and reduce that perception of tinnitus, perhaps, or to get you to hear better, your loved ones, parties, restaurants, wherever it might be. We have a lot of great tools at our fingertips,
Thank you
and
so
and
much.
more on the horizon. Mhm.
Thank you so much, Dr. Ramsay Poindexter. Appreciate you coming on here, sharing your expertise. I'm
Thank you.
Dr. Ben Thompson. We are audiologists. That means we specialize in tinnitus and hearing. You can find us through our website in the description of this video. And we encourage you to leave a thumbs up, whether you're watching this on YouTube or Facebook. It does help make sure that YouTube or Facebook knows that you enjoyed this video. Again, thanks for being here, and we'll talk to you at the next live stream. Bye, everyone.
Bye bye.